Hi, are you getting enough sunshine? Are you getting enough vitamin D? I'm Donna Denson, the Dynamic Diabetic, and it's been found that most of us are not getting enough sunshine or getting enough vitamin D. Today, I want to talk to you about 20 signs that you may have a deficiency in vitamin D and what that would mean for your health, what that would mean to a diabetic's health. When your vitamin D is low, it can cause chronic diseases. It affects your bones, it affects your immune system, and it affects your insulin. So let's talk a little bit about vitamin D. The sunlight vitamin, right? It's a hormone and it activates if you leave off protection when you go out in the sun for about 10 or 20 minutes. So don't put sunscreen on for about 10 or 20 minutes to allow the sunlight to work and help your body to create vitamin D and absorb vitamin D, okay? You can take supplements over the counter. There's all kinds. They're not as effective as sunshine. The way that humans were built was for sunshine, but you can take supplements to help. So, what are the signs that maybe this is a problem for you? First of all, are you frequently sick? Do you seem to catch every cold, every flu, everything that comes down the pike? Well, you probably have low vitamin D, which causes you to have respiratory infections. Number two, are you excessively fatigued? I mean, like you're all the time tired? Could be low vitamin D. Number three would be bone loss. D helps you absorb calcium, and calcium is what keeps your bones strong. So you could be looking at osteoporosis or some other bone disease if you don't have enough vitamin D to help you absorb calcium. Is your head sweaty? This is especially true for babies, for infants. Are their heads sweaty? If the mom had low vitamin D, then the infant would have low vitamin D, and that would be the big sign, would be a sweaty head. Now, you might also get that as an adult, but primarily that is used to help diagnose an infant that has low vitamin D. Are you depressed? With COVID and everything else, a lot of us are depressed, right? But people who live in dark places that don't get a lot of sunshine, like maybe Alaska or Oregon, they can get very depressed because there's not enough sunshine. And they actually buy what they call light boxes to light up their homes to give them that extra light. Female infertility has been directly tied to having low vitamin D. Almost everyone treated for low fertility, females, have been found to be low in vitamin D. Heart conditions. Heart conditions, congestive heart failure, low vitamin D. Okay, so vitamin D deficiency is no joke, guys. Hair loss. Okay, low vitamin D will cause you to lose hair. You might have overall thinning, of your scalp hair, or you might have your whole body lose hair from low vitamin D. So if you're having that issue, you want to have your vitamin D checked. Lupus. Lupus patients are photosensitive to sunlight, okay? They have to be very careful. So they are definitely at risk of low vitamin D, and they may have complications because of that. So they need to be on a supplement of some sort. Number 10 is multiple sclerosis. Yeah, you have an increased risk for multiple sclerosis, and for countries that are like south of the equator, they don't, further away from the equator. The further away they are, the less bright the sun is, the less intense the sun is, the more MS they're finding. Skin cancer. Now, I know we've preached about use sunscreen because the sun can cause skin cancer. But in some cases, if you're getting the right amount of sunshine, all right, it can help prevent breast cancer and prostate cancer and colon cancers. So there's a plus side to sun where cancer is concerned too. Um, Childhood deficiency of vitamin D puts children at risk of more asthma, more allergies, and other things as well. So can cause great problems if they're low in vitamin D. This is something your doctor should check if you have any suspicion at all. Brain health, dementia, Alzheimer's, um, vitamin D receptors in your brain tissue. Okay, they absorb the vitamin D, and you need that for brain health. So when you're looking at people developing, especially early on, developing dementia or Alzheimer's, vitamin D may be playing a vital part of that. Adolescent behavior problems. Right now, I think this is a huge thing. Ages 5 to 12 normally, they're more aggressive and they're breaking more rules. They're just edgier, right? And with our kids not being in school and not being able to socialize, they're not outside as much getting vitamin D. Guess what? They certainly might get a little unruly. So if you're experiencing a change in your child's behavior, you might look at vitamin D. That's kind of crazy, huh? Chronic pain is definitely related to vitamin D deficiency. Causes your muscles to ache, your back to ache, you get bone pain. That is coming perhaps from a deficiency in vitamin D. Obesity. Vitamin D in a new study shows that it increases the number and size of fat cells when you're low. So you need vitamin D to help with that. Okay? When you're low, your fat cells are more, you get more of them and they get bigger. Not good. Oral health. Vitamin D plays a big part because of calcium. They work together. And so they keep your bones strong, your teeth, your jaw, and even your gums are affected by how much vitamin D is in your system. Skin absorption. You know, people with darker skin have a harder time absorbing the sun, or absorbing other vitamins as well. And so the vitamin D helps with that. The sun helps with that to help them absorb, especially like calcium. Gut issues. If you have low vitamin D, you might have Crohn's disease. You might have ulcerative colitis. You might have IBS. You might have liver disease. Oh my gosh, low D. And number 20, and the reason I so wanted to do this is because of diabetes. Vitamin D is linked to insulin resistance. Insulin resistance, which is the real problem with diabetes, is insulin resistance. So your cells respond better to insulin when you have enough vitamin D. If you are deficient in vitamin D, then your cells are not responding as well to insulin, and that can cause the whole cycle. So vitamin D is extremely, extremely important. 1 billion people worldwide suffer from a deficiency in vitamin D. 40% of Americans suffer from vitamin D deficiency. You don't want to be one of them, especially if you're a diabetic. This is playing with other things into your system, and none of them are good. None of them are good. I hope you learned something today. I hope this was good and beneficial, and that you will think about those symptoms and make sure that you don't have any. And if you do, get your vitamin D checked. Find out what you can do to make it better. As always, I ask you to share this video. Let other people know about the importance of this. This is stuff that anybody can benefit from, but especially diabetics can benefit from the knowledge that I'm offering. And knowledge is power, and that's always what I'm trying to give you, is more power to take care of yourself. I hope I found you safe today. I hope I found you well, and I found you happy. If you haven't subscribed, today's the day. And there's information in the comments about Facebook group to help you, the Diabetic Minute I do every day to help you, and also if you would like a consultation, free consultation with me, please sign up. Thank you so much. This is Donna Denson, the Dynamic Diabetic. Thanking you so much for being here, and may God bless and keep you until we connect again. Bye-bye.